Welcome everyone. I'm Dr. Karen Richardson. I'm going to be talking to you today about the menstrual cycle. Another term that's sometimes used is also the uterine cycle. Let me see here. And of course it's referring back to the uterus. So I thought we would go back and look at some anatomy first and review the parts of the uterus before we begin. So that we have here, we have the parametrium, which is the outermost layer of the uterus wall. It is thin connective tissue. Here we have the myometrium. Myo, of course, is referring to muscle, and this is a thick, smooth muscle layer, which of course is involved in childbirth. These are going to provide the contractions to expel the baby from the uterus, and it's also involved in the smaller type contractions that we might see with cramps during the menstrual cycle. Now the innermost lining is the endometrium, and this is of course what we're going to be referring to with the menstrual cycle. This is where menstruation takes place. So this is this innermost lining here, and it is very important for two reasons, of course. What we're going to be talking about today, the menstrual cycle, but this is also where an implanting embryo will develop. Okay. Now, so let's look up a little bit closer at this endometrium. When we look at this and we blow this picture up, we see that it's actually two layers. That we have this layer here, which is going to be the layer that sheds. This is the stratum functionalis. And the word functional is telling you that something happens. There's a function to it. It's going to cycle each month and leave the body as the blood flow. So we tend to think of it, of course, as being very vascular. Lots of tiny little blood vessels here. We have this, these are the spiral arteries, and it's applying the blood to the endometrial layer. But we also have other things going on as well. We have an thin epithelial layer. Epithelium, we know this is the type of tissue that covers and lines different types of body parts. So we have a single thin cell layer here at the very surface of the endometrium. You also notice that you have this glandular tissue here, the uterine gland, and they're going to be producing secretions to help nourish a developing embryo. So we are going to produce glycogen for an embryo that might land here and try to implant. So the purpose, of course, is to provide a nice nutritious setting for possible embryo. And of course, all of this here, all into here is connective tissue. So again, it's not simply blood. There are other types of cells and tissues involved. Part of this uterine gland is going to also die and be sloughed off each part of the month. Now the part that remains in place is here, the stratum bassalis. This is connective tissue, and its primary purpose, of course, is to help replace the layer that gets sloughed off each month. All right. Now, on average, a woman has a cycle of 28 days. And again, we all know that that's an average. There are women who are going to have much shorter cycles. There are women who are going to have very long cycles, and they'll be consistent. And then unfortunately, there are some women who have irregular cycles, which will be short 1 month, long 1 month, maybe they'll skip a period. So some women cannot say for any given reason that they are normal. They do not have a normal cycle flow. But we're going to use, of course, the average. Now, when we look at the whole cycle, when we say cycle, we're implying that things are moving in a circular pattern, that we're going to repeat everything every month. So what we do is we actually can divide this up into 3 phases of the menstrual cycle. So we're going to always start with the first day of the blood flow. This is going to be day 1. And we're going to take those days of the menstrual flow, we can call this menses, or think of it as the bleeding time. This will typically on average 1 to 5. And again, some women will have 3 days. Some days, some women can go as much as 8 days of blood flow. So again, I'm using an average. So day 1 through 5 is going to correspond to the loss of this endometrial lining. And so this picture is really nice. You can see how this functional layer is being sloughed away, leaving us with the basal layer still in place, ready to replace it in the next phase. Now, the next phase is the proliferative phase. This is roughly day 6 through 14 of the menstrual cycle. We're going to give it the name proliferative because the word proliferate means to increase in number. And that's what we're doing. We're rebuilding this functional layer that we lost. So as you can see, this is always nice to see these pictures, how well they're showing this, how the size of this functionalis layer increases. We're rebuilding it, getting it ready in case there's an embryo. Now notice here, this rising pink right in here, this is representing estrogen levels. And notice that they are getting much, much higher. Estrogen is going to be our stimulus, the chemical that's telling this functional layer to regrow. So we're going to have receptors here in the endometrium that respond to estrogen and cause this proliferative phase. Now, at this point, you need to get comfortable with the ovarian cycle as well. The ovarian cycle and the menstrual cycle are simultaneously going on at all times. It's difficult to talk about one without referring back to the ovarian cycle. So I've put this picture here showing the phases of the ovarian cycle, because all the purpose that we've got here is, of course, to have a baby. So the follicles that are going to ovulate are increasing in size. They're getting larger, more developed. And of course, the purpose is for ovulation, to have an oocyte that is released once a month. Now, all of these cells around the oocyte, these follicular cells, are increasing their output of progesterone and estrogen, primarily, of course, estrogen at this stage. And of course, that is signaling the lining of the uterus to increase and proliferate in case we have fertilization, because ovulation is on its way. Now, if we look at an average 28-day cycle, when is ovulation occurring? Well, if we look here, it's roughly day 14. Now, again, this is an average female. It can be different for different lengths, if you have a short cycle or long cycle. But if we're looking at this and we see that estrogen is rising, this rising layer levels of estrogen are going to cause luteinizing hormone from the pituitary to have a sudden surge. And we're going to get this peak of LH that occurs right here, with LH. And that's our direct cause of ovulation. So all of this estrogen that's getting produced by the follicle cells is going to lead to LH being released. And that in turn causes our ovulation, which is going to appear roughly right at the end of this proliferative phase. We are trying to get this layer ready in case there is a pregnancy. Because when you ovulate this oocyte, if sperm is present, we can get fertilization, and this developing embryo wants to implant here. Okay? It's going to take several days to travel through the fallopian tubes into the uterus, and it'll land right here on this functional layer of the endometrium. And when it does, hopefully, this layer here is thick enough and nutritious enough to support a developing embryo. So that leads us to the secretory phase. Here we said that ovulation correlates to the end of the proliferative phase. We've rebuilt this functional layer. We're ready in case there is an embryo on its way. So we've also got to think about, how do we maintain this? How do we keep this in place? Because we know that eventually it's going to be lost, to be sloughed out in the menstrual flow. So we've got to have a hormone that can signal this to stay in place. So we go back and we look at the ovarian cycle, and we remember that after ovulation, these follicle cells, they change. They become the corpus luteum. So the follicle cells become a very important part of the reproductive cycle. You have to have this corpus luteum in place or there will not be a pregnancy. The corpus luteum's job is to produce lots of progesterone. So if we look down here at the graph and we see this nice green area, notice how the progesterone levels are going up in this part of the menstrual cycle. We are getting lots and lots of progesterone from the corpus luteum. And why? Well, progesterone's job has a lot of jobs in dealing with the menstrual cycle. It is going to change over this area into what we call a secretory type mucosa. We're going to be secreting lots and lots of glycogen in case there's an embryo. Remember, if we said there's a fertilization occurred, that the little embryo is going to land right there? Well, we want to have these uterine glands ready. They're going to be turned on. They're going to produce lots and lots of glycogen in case there's an embryo. It Progesterone is also going to cause the formation of something called a cervical plug. And the cervix will start increasing its production of thick mucus. We're going to block any further entry of sperm. We're going to also block bacterial infections, try to protect a developing embryo. And one of the most important parts of progesterone is to keep the myometrium quiet. Down here below the basal layer, in that thick layer of smooth muscle, we don't want any erratic type of smooth muscle contraction, because at this point the embryo is very, very fragile. It could easily be disrupted and not implant, and we could lose the pregnancy. So at this point we want a signal telling the layer of endometrium to stay quiet. We don't want any contractions. We want nothing to disrupt the implantation process. So it's going to tell these arteries to stay where you are, keep a blood supply, do not have any contractions, and keep these uterine glands producing lots and lots of glycogen. Now, obviously in most cases no pregnancy occurs, but let's look and see. We had ovulation. Let's say we did have a fertilization. Corpus luteum is in place. Here at the moment of fertilization, if you look at this, baby starts putting out something called human chorionic gonadotropin, or HCG. This is our signal that there's a baby in the endometrium, that we do not need to lose the corpus luteum just yet. Because if we do, we're going to have a menstrual flow, and the baby will be lost. So we've got to keep the corpus luteum in place. This corpus luteum is vital. So if there's a baby, and if we get HCG, it will tell the corpus luteum to stay for about 3 months. And then roughly around 3 months, the placenta is large enough to start producing our hormones here, progesterone and estrogen. So at that point, the placenta takes over. And interestingly enough, this is what women are testing for. If you take a pregnancy test, there is HCG in the urine as soon as a week after conception. And that is what women are checking to see if they're pregnant. Now, of course, most cycles there is no pregnancy. There is no implanted embryo. There is no HCG. So if there is no signal telling the corpus luteum to stay, the corpus luteum will degenerate. It lasts roughly 14 days, which is long enough for an implantation if there is one. But if there is no signal, it will turn into this corpus albicans, which is scar-like tissue in the ovary. And because there's no corpus luteum to produce progesterone, the myometrium is no longer going to stay as it is, and we're going to get the menstrual flow. Okay? So we're back to the first part of the menstrual cycle, the menstrual phase, day 1 through 5. Remember, this is a cycle, so we're going to go right back. So there's no corpus luteum here to produce our progesterone. So now the spiral arteries, start to constrict. They start to go into spasms. They don't have that progesterone keeping them alive and healthy. So that cuts off the blood flow to all this tissue up here. And if you don't get blood flow, those cells will die. So the epithelial tissue dies. Most of these parts of these glands here will die. All of the connective tissue, all of that is going to die and slough off. You're going to see the menstrual flow. You're also going to get cramps, okay? Dysmenorrhea, of course, this means painful menstruation. Some women, of course, refer to this as cramps, and these are actually mild uterine contractions that are helping push out this dead and dying tissue out of the uterus. So, now, some women, during cycles, women want to know when they can become pregnant. If you're starting a family, you want to know when you ovulate, or if you don't want to become pregnant. So it's interesting to go back and look and think about when is ovulation occurring. Now, we said that the average 28-day cycle, that ovulation occurred on day 14. And it would be tempting to say that a woman ovulates halfway through her cycle. But we know this isn't true. So we have to actually look at what is consistent. We know that some women have short cycles, some women have long cycles, and their ovulation is occurring at a different place. The only thing that's fairly consistent is the luteal phase, which is always 14 days long. And that is the length of time from when you ovulate to when you start your next cycle. And that's the only part. This other part toward the front end here can vary in length according to your cycle. So let's look at a woman who has a very short cycle. She only has typically 24. And again, you're talking about someone who's fairly consistent. She always has a 24-day cycle fairly well every month in order. So she can pretty much say that she's going to have a short cycle. So what she should do if she wants to know when she ovulates is simple little math here. You go in and you say she has 24 days minus 14. So what is happening is that her first day of blood flow on day 1, she would say that 10 days from now she would be likely to ovulate. So that would be her point. So if you were looking at this and you were trying to say half of 24 is 12, she's not going to ovulate on day 12. She's going to ovulate 2 days earlier. So it's going to be important if you're trying to plan a family. Here's a long day cycle, 36 days. Instead of it, if you do look at it halfway, you might be tempted to say she's going to ovulate on day 18. But the truth is, the only thing we know consistently is that 14 days before her first day, she ovulates. So if you look at her first day, she starts her flow. 14 days later, she's most likely to ovulate. Now, a couple of other terms that you're going to hear related to menstruation is amenorrhea. When we add the A in front of menorrhea, we simply mean we don't have it. It's lacking. So it's the absence or the cessation of a cycle. One of the ways most women find out that they're pregnant is they skip a period. They don't have a menstrual cycle. So it's very normal to have amenorrhea during pregnancy. Now, of course, you're going to hear about the rare female that has breakthrough bleeding during a pregnancy or fairly short but normal menstrual cycles. But 99% of the time, women do not have periods during their pregnancy. Primary amenorrhea means that the female never had a cycle. This could be a young girl who never has the first menstrual flow. Secondary amenorrhea, on the other hand, is a female who has had normal cycles, but they stop for some reason. It can be due to stress. Women can become irregular. They can skip a period simply because they have a lot of stress in their life. It can be a severe illness. They can stop menstruating. And it can be someone who's in very good shape. A female athlete who can have such low body fat can simply stop having menstrual cycles. And then when it's all over, we have menopause, which is the complete cessation of cycles. Technically, we say that a whole year must have passed before you can say that you have been through menopause. And we usually it's the early 50s. Now, that's not saying that some women will not start in their early 40s, and there are women who will start in their 30s, which is very irregular. But typically, we say the early 50s is about when this will start. Now, most people thinking about menopause is actually what's known as perimenopause, which is the months or years before you've completely stopped. So you can't exactly say there's a certain day that you have menopause. Again, the definition is that a whole year has passed without any cycles. So that's part of the problem. So perimenopause, a woman is going to have this change in her cycles. She'll become very irregular. They may be closer together. She may skip a cycle. Her cycles may become very long. Then they suddenly become very, very short until they taper off and they're no longer there. So they're going to become very, very irregular. You're going to see symptoms such as mood changes, depression, irritability, and of course the old favorite, hot flashes. The blood vessels start to get these signals to dilate. So she's very flushed. She gets very hot. She cannot control her body temperature. And so, of course, we see these miserable hot flashes that these women are undergoing. Okay. So again, menopause, you cannot say for sure that a woman has gone through menopause until she has completely been free for an entire year. Well, thank you for your time. I hope you enjoyed hearing a little bit about the menstrual cycle, and thank you very much.